There's an old saying that when white America gets a cold, black America gets pneumonia. That's never been more true than with the coronavirus.
There are several states that have released some of these data that have shown that African Americans are having higher rates of hospitalization, higher rates of death when they do go to the hospital.
In Louisiana, African Americans make up a third of the population and account for 70% of the deaths. Similar disparities exist in other states, too. In New York City, Hispanic people make up 29% of the population, but account for 34% of the city's deaths from COVID-19. That's according to the city's own data. African Americans, Hispanic Americans, and other minorities generally have lower incomes than their white counterparts. Many of them are essential workers, and they often can't afford health care.
We know that blacks have more hypertension, more heart failure. We know that both Latinos and African Americans have more asthma and more severe asthma. And we know that all race ethnic minority groups have higher rates of diabetes by a significant amount, often double what the white population does. These are the three major common underlying disease risk factors that have been identified.
Social distancing prevents disease, but it's impossible for people with low incomes.
How can you tell a single mom with 3 kids to self-isolate if they've had an exposure? Let's say they work as a nurse's aide at a hospital and you've been exposed, you have to go self-isolate. Well, you can't self-isolate, you have to take care of children. Or you can't self-isolate in a household where there's 3 rooms and there's 8 people living there.
In order to survive this virus, your body has to be healthy enough to fight it. Getting the disease is like getting a punch.
And if your body is not in top shape, then that means you're that less likely to be able to tolerate that punch. So if you have diabetes, which is relatively suppressive for your immune system, when you get infections, you're more likely to have worse outcomes. If you have heart disease coming into it, your heart needs to pick up its rate to deliver more blood and nutrients if you have an infection. If you're not able to do that so well, then you're going to have worse outcomes.
Dr. Tyson Bell says now that political leaders are aware of the situation, data can be collected and policies changed. Dr. Eliseo Perez Stable says change will not come fast. He says these health disparities have existed for a long time, and activists, politicians, and minorities need to prepare to run a marathon instead of a sprint. Carol Pearson, VOA News, Washington.
We've got patients in each bed lined up.